Now we move to painful adnexal mass. Here's our case. The 31-year-old woman is taken to the emergency department with severe, sudden lower abdominal pain starting 3 hours ago at work. On exam, her abdomen is tender, but no rebound. What does that mean? It suggests that there's no peritoneal involvement. So we're looking at some structures other than the peritoneum. Ultrasound shows an 8-centimeter left adnexal mass with suggestion of torsion of the ovary. What would be an ultrasound suggestion of torsion? If you assess the blood flow with color flow Doppler, you have decreased blood flow. Anytime you have a unilateral pelvic mass with sudden pain, you need to think, could this be an ovarian torsion? And here you can see how twisted the pedicle can become. And the larger it is, the more likely it is to happen. Here we have an enlarged ovary. This is the uteroovarian ligament, and what vessels run through here? We have the artery and the vein which go through there. Which one is going to get shut off first? The thin-walled vein. Blood still is coming in through the artery. You get hyperemia, you get edema and swelling, and as you get edema, it's going to shut off the arterial blood supply. If you have pain in the heart because of ischemia, we call that a heart attack, right? Would it not be reasonable then, if you have ischemia of the ovary, to call this an ovarian attack? And this is not medical management, this is surgical management. You better get in there pronto. Take it out. Sudden, severe lower abdominal pain in the presence of an adnexal mass by exam or ultrasound. Your diagnosis should be ovarian torsion, and this is a surgical emergency. Get in there quick. Remove the area that has enlarged the ovary, the cyst if it is a dermoid, if the ovary is still viable. But let's say the blood supply has been cut off. It is already necrotic, ischemic, infarcted. In that case, you take out the ovary. But that would be a tragedy if you got there too late. And that is the end of painful adnexal mass.